Good afternoon. I'm Maggie Rivas Rodriguez, and I'm the founder and director of the Voces Oral History Center. Thank you all so much for being with us today on our webinar. It's a virtual showcase of Voices of a Pandemic. Um, all of us have been touched by COVID-19 this year. I'm sure we all know someone who has died from COVID-19. We want to make sure that people can commemorate those people. And as you know, Latinos have been overrepresented in numbers of cases, in hospitalizations, and in fatalities. What we're trying to do with Voices of a Pandemic is show the people behind those numbers, the people whose lives have been affected, Latinos and Latinas, whose lives have been affected by COVID-19. Just today, my husband attended a Zoom commemoration of two of his two friends who had passed away in El Paso. And I venture to guess that most of us have been in some of those Zoom commemorations for people who have passed on. So what we want to do today is tell you a little bit about what we've been doing with the Voices of a Pandemic. And here I'm going to share my screen and show you a little bit about the Voices Oral History Center. Some of you may not know what the Voices Oral History Center, so I'm going to briefly tell you. Our mission is to record, preserve, and disseminate the stories of US Latinos and Latinas and weave those perspectives into our historical narrative at the national, state, and local levels. Our work entails research. We produce an annual journal. It's peer-reviewed called the Latina and Latino Oral History Journal. We produce books, and we're always working on different kinds of research based on oral history. I teach a class here at UT Austin that is about oral history in Latinos, and we hold a summer institute every summer to encourage people to use oral history. We do service, and this program today is part of that service. Voices of a Pandemic is a partnership of 15 institutions throughout the country, and each one of them owns their interviews, but we're able to put them on our YouTube channel and also to process the videos and put them on our website. Whoops, sorry. Our interview locations are seen here on this map. You can see that they're all over the country. And if you can see this is where they're located. Most of them, because we have a large presence in Texas, have been here in Texas, 26%. But as you'll see, Illinois, Florida, Nebraska are other states where we've also done several interviews. Some of the other factors that have emerged during this pandemic have been political turmoil at different levels of government, and some of the here in Texas we've had at the state level one message, at the local level here in Austin a different message, and that's part of the story of the pandemic as well. We've also seen other factors that have entered into our questions. So what we've been trying to do is incorporate some of these aspects of the pandemic into our interviews. Social justice activism after the murder of George Floyd, elections and campaigns and how they were affected by COVID-19. So today's program, we're going to ask you to ask your questions online. We'll answer them as we can, but there is going to be time at the end of the program for this. Our panelists today are Virginia Espino. She's a lecturer in the Department of Labor Studies at UCLA. Lilia Fernandez is a professor in the Department of History and also in Latino Studies at Rutgers University in New Brunswick, New Jersey. Gil Cardenas is a professor emeritus of sociology in Notre Dame. Pepe Coronado is an artist and printmaker at Coronado Studios here in Austin, Texas. Nikki Diaz is based in Austin. She's an artist who put together a beautiful piece that you may have seen. You saw that at the opening slide, to illustrate in her own way and interpret Voices of a Pandemic. So I turn it now over to my, my colleague, Virginia Espino.
Thank you so much, Maggie. It's great to be here with you all. Thank you for joining. When Maggie first approached me about participating as an interviewer and institutional partner with the Voices of a Pandemic Oral History Project, I was excited to collaborate. My experience in oral history taught me that successful oral history projects need the kind of leadership that Maggie Rivas Rodriguez provides. She's innovative, flexible, and open-minded when it comes to collecting stories during a pandemic, when interviews cannot be conducted in person. Maggie and her team of graduate students created an easy-to-use workflow that would allow for interviewers to record oral histories with the Zoom app. From training interviewers to processing video footage and transcription, and then making interviews available are all benefits of a collaboration with Voces. Just a few short weeks after I conducted my first interview, the Voces team made it available to the public on YouTube. I was very excited to see such a quick turnaround. Much of this important back-end work is free. It's free to the institutions that sign on. And I cannot express how valuable the trainings have been to me and my collecting efforts in Los Angeles on behalf of UCLA Labor Studies. I have trained students and faculty from campuses in my area and have witnessed interviewers collect narratives from people who often go ignored in a documentation of major historical events like the one that we are living. And quite often, the Latinx story is told with a narrow view of the diversity in the Latinx community. Maggie's call to document the Latinx experience during this pandemic by offering training, processing, and public accessibility to the interviews means that we get to tell our own stories. 100 years from now, we will have a rich archive of our pain and our resilience. We will know how COVID-19 impacted some of the most essential workers in our diverse communities, from a doctor in a small family medicine clinic in Venice, California, to a dental assistant in Elgin, Illinois, to a factory worker in Florida. Voices of a Pandemic ensures that our stories will live long after we are gone. So back to you, Maggie.
Thank you very much, Virginia. And back at you, because working with you has really been a great pleasure. And with all of our colleagues, we've been over the summer, we were having weekly Zoom meetings so that we could all make sure that we were on the same page. And I'm going to guide you through a little bit of what of why oral history is really essential to telling the Latino story at this point. So I'm going to share my screen again. And so Voces was established in 1999. Because of that, we've had a chance to really do a lot of tweaking of our system and borrowing great ideas from other oral history centers and other oral history projects. Why is oral history so important? Well, the reason is because you know that Latinos keep on getting left out of history books and out of documentaries, and God knows we don't have enough presence in feature films. And one of the reasons for that is because there has not been a great wealth of primary source materials to use. It's not the only reason, but one of the reasons. And that is one thing that we can do something about. So what oral history does is it creates that primary source material that can then be mined to use to include in research, in journalistic treatments, and in a variety of different ways. So how is this different? So in oral history, we depend on an interaction between the interviewee and the interview subject. The question and answer part of this is really essential. And what Virginia was talking about a second ago was the training part of it is really essential, because the best oral history interviews are by interviewers who have really been trained and understand the subject matter. And so they're able to ask informed, smart questions and get the sort of detail that is going to really make a difference and be a really important part of the oral history project. So I'm going to give you an example of why oral history is so, and why questions are so important. This is me in 1992. My father was a World War II veteran who was in the Army and was stationed in the Aleutian Islands off the coast of Alaska. In 1992, he and I traveled to Alaska, and we were able to retrace his steps. So we went through the whole thing. We were there for several days. 7 years later, I interviewed my dad for what used to be initially the US Latino and Latina World War II Oral History Project. During that interview, my father told me about seeing the Japanese Zero airplanes strafing the island. It was great, and he had a lot of detailed information. So after the interview was over, the cameras were off, and I turned to him and I said, "Daddy, you and I went to the Aleutian Islands. You never told me that you saw the Zeros strafing the island." And he looks at me and says, "Well, Mija, you never asked." So to me, that really underscores the importance of that interaction. It's more than just sitting in front of a recorder and recording your thoughts. It's having someone who's really listening intently and asking those follow-up questions that make such a difference. So the other thing that an oral history project requires is that it has to be a recording. It has to be recorded either on audio or video. That recording is that primary source, and it's as close to the original source of the person speaking as possible. Later on, it can be interpreted and it can be used by others in a variety of different ways without the interviewer mediating that. It has to be held in a publicly accessible repository. That can be at a library, a historical society, it can be online, but they have to take care of these interviews. You really take care of those interviews so that in 100 years, that voice, that recording will still exist. So it's kind of a technical thing, the preservation component, but it's essential. You have to have some sort of signed consent form or a deed of gift so that someone, it's very clear that this person is entering into this interview in a informed way. And so this is a copy of our interview form that we used at the very beginning of our interviews. If you try using an oral history interview in a book, an academic book or a journal article, you will have to produce these consent forms. So that's one reason that it's important. But the other part is, it's just good stewardship. Later, these interviews can be used in a variety of different ways. Some of the interviews we've conducted for Voices of a Pandemic have been used in newspaper articles. The reporter listened to the interview and then incorporated those into her story. In broadcast stories, some of the interviews that we've produced already for Voices of a Pandemic have been used in radio stories and television stories. So that's another use. And in research, I mentioned earlier the US Latina and Latino Oral History Journal, and the next issue will feature some research that came out of our Voices of a Pandemic. What Voices does different than most other oral history projects is we are completely dedicated to the Latino community, to the Latino experience. Our criteria for an interview is people have to either be Latinas or Latinos, or they can be non-Latinos and Latinas, but people who have had an important role in the Latino experience. And we take that very seriously, and we think it's important because it puts a spotlight totally on the Latino experience. We do something that most folks don't do, and it's a pre-interview form. It's a pain in the neck to fill out, frankly. It takes about 20 minutes, but it provides a kind of detailed demographic information. If someone was in the military, where they were stationed, lots of other details, their parents' names, their parents' dates of birth and where they were born, the interview subject's date of birth, of course, what schools they went to, that sort of thing. And this is a pain in the neck, but as someone who has used these pre-interview forms for some of the research that I've published, it's really helpful. And so people later thank us for this. When Voices of a Pandemic struck, Virginia Espino mentioned, we have a small team of people and our partners agreed to follow all of our protocols. That pre-interview form, we put it online. So people now will do, it's a survey type of thing, but you enter into the survey and then you download this information. So we still have the same exact pre-interview form. It's bilingual. We have one version in English, one version in Spanish, because some of our interview subjects are Spanish, Spanish only. Now what we're doing is we have to have a recorded preamble in the interview. And that recorded preamble has to spell out exactly what it is. And we have to have the interview subject agreeing to whatever the conditions are. And so they have to agree that it has to be that we're explaining to them what the interview is, where it's going to be housed, how it's going to be used, and they have to agree in the recording. After that, Voces will take that recording, and when you're in the first of a Zoom call and you're like, can you hear me? Is my camera on? We edit out that first part about it, and then we put a slate, like this beautiful slate that you see on the screen. And then we start the interview where someone is saying, today is XX, my name is XX, and I'm interviewing whoever. We also have, since we're not doing consent, because we're not doing these, all our interviews are on Zoom or by telephone, very few are in person. We do have something called a deed of gift, which is the same thing as a consent form. So the deed of gift matched with that preamble that's recorded gives us gives whatever institution ownership of this. And so it's maybe a little bit more detailed than you really want, but it's kind of important. So the other thing that Voces does is we keep track of, there's lots of moving parts on this. And so we keep track of all that. And we make sure that everybody is doing what we're getting, all the parts that need to be archived. So Virginia's right. We do have a small group of interns. Right now we have 5 interns and a graduate student working with us. People think because we're at the University of Texas at Austin and we have a fabulous athletic department and a football team that keeps on spending millions of dollars on coaches, that we also have millions of dollars. But the fact of the matter is that Voces is always having to raise its own money. So we do things like raise money through these crowdfunding sources so that we can pay our wonderful interns. So that in essence is what the Voces signature is. And I'm really delighted that we've had so much great luck with attracting partners. And I'm turning it over now to Lilia Fernandez.
Thank you, Maggie. It really has been a pleasure working with Maggie and her team at UT. And here at Rutgers, my students and our team, we were able to conduct a number of interviews over the summer. And I wanted to talk a little bit about some of the themes that we've identified in the oral histories that we and the other institutional partners have found. The pandemic, of course, has magnified enormous social inequalities in the US and made them much more visible. We saw a clear division between those workers who have the luxury of working from home, although it may not always feel that way, and others who have to be at the workplace every day, especially essential workers, of which Latinos make up a disproportionate segment. You cannot ring up groceries, clean buildings, perform construction work, debone chickens, or pick vegetables from home. Those social inequalities also became visible among our students from pre-K through college. Lower income students, many of whom are Latino, struggled with reliable access to the internet and computer technology. They had to share often crowded home space with siblings, parents, grandparents, or other members of the household. Of course, the pandemic has had an enormous impact on small businesses that had to shutter their doors and lay off workers. And this was particularly true in the restaurant industry in states that observed complete shutdowns. But our interviewers also experienced this at hair salons, retail stores, and in other public-facing jobs. Political organizing and canvassing came to an end as well, as people could no longer go door to door to register voters or go out in public and protest in most cases. And government meetings that switched to virtual formats now saw restricted and reduced public participation, making it harder for residents to comment on important policy decisions that would affect them and their families in local communities. In that regard, small community newspapers also lost major advertisers to the pandemic, and we have yet to understand the magnitude of that loss. For Latino elders who live alone, many lost important personal contact with family members and experienced isolation and loneliness, though some did learn how to use technology or other ways to reach family and loved ones. And many people have experienced the loss of loved ones who fell victim to COVID-19. Still, our community showed its resilience and carried on. They organized mutual aid efforts to support the neediest in their communities, especially the undocumented, those who could not qualify for unemployment insurance or stimulus checks. Our healthcare professionals worked day and night caring for the sick, especially bilingual workers who played a critical role in communicating with Latino COVID patients who do not speak English. Teachers adjusted to remote learning and continue their lessons with their students. And those who became sick or had to care for loved ones at home because they were denied hospital care or were simply sent away, used home remedies, remedios caseros, to get better and overcome this disease. The pandemic also mobilized people to act. They joined protests for racial justice after the murders of George Floyd and Breonna Taylor. They became adamant about promoting mask wearing and taking precautions, particularly among those who saw masks as a political symbol. And more than anything, people in our community carried on with their lives as best they could. We have a short video that gives you some excerpts of some of those oral history interviews, which we can hopefully play now, to give you a sense of the geographical breadth of our work and of the different voices that we heard from through this project.
We knew that if we closed, the students that would have the hardest time adjusting would be our Latino and African American students because of the lack of technology access and the lack of experience navigating the online resources that we had. We also had a large population of English language learners that had very little experience working on a computer, much less navigating the software needed for online courses. And so our president was adamant that if we could stay open, we would stay open.
Mi primer pensamiento fue, ¿cómo voy a hacer yo para pagar mi renta? ¿Cómo voy a hacer yo para comprar mi comida? No tenía fuerzas de cocinar, no tenía fuerzas de hacer absolutamente nada. Yo no quería nada, no quería que nadie me hablara. Me aislé y lloré mucho. Y a las personas, a mis amistades más cercanas, yo les comenté lo que estaba pasando.
I wore my name, my name. I had Lieutenant Martinez on my uniform, on my PPE. So they knew just by the last name I was Hispanic, okay? And then they would start talking, and I would, if they didn't speak English, I would just start speaking to them in Spanish. And I could see they were like, oh, thank goodness. Like, oh, okay, you understand, okay.
And I walked in there with gloves and my mask. And still, it's new to me wearing gloves and a mask, but knew I had to have it on. So I was very safe with it. They said, you can spend as much time as you can, as you want to with him. We'll give you as much time as you want to be in private with him. So I got to go in and see my dad. He had already passed for about an hour and a half.
they're losing sleep over their family members being in the hospital. They can't see them. They can't, you know, talk with them. They can't touch them. They can't hold them. I understand that completely. Like, it's a scary situation to be in.
You would have people who felt so much anxiety and despair that they would stand in line and have their kids up in a parking lot or in a street at 5 o'clock, 3 hours just before the start of testing. And then depending on how long the line was, they could potentially be there for 6 or 8 hours with their kids waiting in line to get a test, right? And it made me angry and sad and all of those things. And we all went through that whole experience. And so again, for me personally, that's been my personal motivation, is to see that first day, like I said, when I went through that testing, I cried like a baby all the way home. I was really, hold on a second. It's still hard to talk about it.
Those are just a few of the interviews that we've been able to conduct, and we hope to do many more, of course. But now I'd like to turn it over to Gil Cardenas, who is going to talk to us about the artwork related to the Voces of a Pandemic project. Gil?
So how do I switch?
You're on, we can hear you.
Okay, just a second, please. Just lost it. Okay, sorry, can you see me?
Yes.
Yes.
Okay, it's a pleasure to serve on the council as a member to Voces and to participate in helping Voces develop a new goal of using visual arts to help accomplish its mission. This first effort to make a visual art connection to Voces oral history program entails working with an independently owned Latino fine art print studio here in Austin. Pepe Coronado is the director of the print studio, and he has worked nationally as well, not just here in Austin, but in New York and Washington, D.C. and other places. He's also working with Jonathan Regoyoso, who is a master printer, and both of them have done a lot of work in this area. We were very fortunate that they were able to secure Nikki Diaz to create a fine art print. It's entitled Raíces Fuertes, Corazones Fuertes. And this is the way that we're, again, adding to the oral history initiative by addressing Latinos in the current virus pandemic. Nikki's print brings attention to the Latino community by her visual storytelling and to our individual and collective experiences in this public health crisis. Nikki was born and raised in El Paso and has graduated with a BFA in painting at the University of Texas in El Paso. She currently resides here and works at Mexicarte Museum. I'm going to ask Nikki to say a few words about her, the symbolism and the title of her print and its meaning. Can you go, Nikki?
Yes, I'm here now, Dr. Cardenas. Thank you so much for having me. First of all, I want to say that I'm extremely honored and grateful to have done this. And I want to thank you and Pepe for seeking me out. I was very flattered. So the artwork, so primarily, let me backtrack a little. I work in painting and collage making. And so when I was reached out by Pepe Coronado, first of all, I was really shocked and honored because he's a very prominent artist to me. And when he mentioned the project was about, you know, speaking about the pandemic and everything, that was also a bit intimidating to me, but I really, it's just hard to capture something so large and you know, trying to focus on what exactly I wanted to say. But from the get-go, I wanted to focus on the strength basically of the Latinx community. And a lot of my work, my personal work, focuses on my upbringing. I'm, like Dr. Cardenas said, I'm from El Paso, Texas, and a lot of my paintings focus on telling a story, like my experience as a Mexican American, my family's experience. And when I found out how Voces, their mission is to document the Latinx experience, I thought, well, I kind of do that in a visual way also. So we chose this image of these people who just represent Latinx people as a whole. And I placed them in a tree, and I wish we could have the image up right now, but it's okay. You can see it on the website. I use a lot of symbolism in my artwork. So for example, in the artwork, I use milagros, which are symbols of just different, people use them to pray for different aspects of their life. And I use different body parts. I thought about like how people are impacted by COVID, you know, their health is deeply impacted. They have long-term issues, things like that. And so I also added pomegranates, things like that. Things to me that are symbols of eternal life and beauty. And it all accumulated to this image of how I wanted to portray how we have a lot of strength and perseverance in our community, basically. And then I thought about, you know, the tree, we're all interconnected, and there's roots in there. We have strong roots, and I feel like after watching a lot of the interviews too, through Voces, like we all have very similar stories and experiences, and I just wanted to try to illustrate that in this image.
Thank you, Nikki.
There it is.
So Coronado Studios, again, as I mentioned, it's located here in Austin, East Austin. Pepe Coronado was born and raised in the Dominican Republic and currently resides in Austin, having spent a significant amount of time in Washington, D.C. and New York. Pepe and his assistant, Jonathan Reyoso, provided artists with experience and expertise in producing fine art prints at the studio and offering a variety of techniques to do the prints. I want to turn to Pepe now to gain more insight about creating the print. So Pepe, can you comment about that and talk a bit about the print?
Yes, of course. Hi, Gilberto, and thank you for the introduction. And thank you, Maggie, for all you guys do at Voces. And I just want to say that, you know, listening to and knowing more about what Voces does is very parallel to what we do visually. We are a studio that has a long history in the Latinx community in the US about the printmaking, all the way from self-help graphics to Seria Project to our project in New York, working with Caribbean artists. So the idea of this process, especially the screen print process, is a collaborative environment. So we are always collaborating with artists. And I always say that prints are a way to take the temperature of different times. So it goes really along the lines of what those interviews and those oral history that Voces produces, because we can go back in time and look at prints from different eras, and we can tell a real story. So these projects that concentrate on on Latinx artists, on Caribbean American artists, is very crucial to the whole story and what does our story means in the largest society. So it's very important that these grounds stay fertile and producing artwork. So when Gilberto contacted me about working on this project, and I contact Nikki, and it demonstrates how the process works, that we are all organically now connected through Voces. And I really love when academia or academic projects can use this kind of artworks to aid their story. So it kind of, one medium helps the other. There is a lot of things that you can write, but there is a lot of things that images can say, and vice versa. So I think that the image with the research provide a very healthy kind of balance for us to understand the real and the big picture. So we are a community-oriented project that are building on that same idea of collecting and cataloging and archiving all their artwork from our artists through time, so in the form of prints. And the advantage of printmaking, just to support this project, is there is a process that creates multiple. They are original pieces, and throughout the process, we wanted to make sure to preserve Nikki's original concepts, but applying them to this like Nikki said, such a big concept of the pandemic. But now we have 100 copies, similar copies of this original piece. They're handmade, they cannot be reproduced again. They're printed in this amazing paper. So they're very unique. They're all, been approved and treated by Nikki, and Jonathan and I try to do the best we can to make sure that the print came out the way Nikki approves it and wants it. So I hope that everybody can start collecting this because it's a very, very significant historic piece. So, and thank you for, I'm very grateful to be part of this.
Thank you, Pepe. So I want to ask all of you to consider acquiring one or more of the prints. They are very affordable, original prints. They're signed. I urge you to get them now, as their availability is quickly diminishing. We started with 100 prints last week, and only 75 are still available. The acquisition price will increase as the number of available prints diminishes. So let me repeat, very affordable, beautiful print. $290 is an exceptionally low starting price for a print of this sort. Voces will utilize this print for multiple purposes. You will not only have an important piece of artwork that you would acquire and to keep and enjoy, but also at the same time, you will be provided with, you'll provide support to Voces to fund its oral history program and to expand its reach to diverse publics. In addition, you will also help provide support to a Latino print studio and to a Latina artist who created this print, as well as helping to expand the availability of Latino art in the United States. So I want to give thanks to Pepe and to Nikki for doing such a great job. So to the audience then, please spread the word to friends that they and others can acquire Raíces Fuertes, Corazones Fuertes for home, for work, to give to family, or possibly to donate to a favorite nonprofit organization or possibly a museum. This work will be perfect for a workplace setting, so let your bosses know and your business associates know that it'd be great to acquire this print now. Gracias.
Thank you very much, Gil and Nikki and Pepe. You all have given a dimension to Voices of a Pandemic that we didn't have otherwise. And what I really love is, I love when people look at our Oral History Center and the interviews that we've done, and then find what they're most familiar with and their special skills to interpret it in a different way. I know in the past there have been plays that have been built around some of our interviews as well. So I'm looking forward to other people taking their own skills and finding ways to extend the word and to amplify our voices. I'm gonna share my screen because I want to folks to be able to see what that artwork looks like right now. So hang on one second. And where is it? It is here, I think. There it is right there. So this is the beautiful artwork that Nikki put together. Right now we're offering exclusive access for a little bit before they go on general sale, which means that we're trying to get them to sign up. So just if you go to our website, vocesofapandemic.org, you'll go under shop and you can see Nikki's print and you can study it a little bit. These are the milagros she was talking about that you can see here, and the heart here. It really is beautiful. We had one question, and I don't know if there's some other questions coming from the audience. One was from James Aldrete, and I'm going to direct this question to Virginia because I know, Virginia, you've done several interviews. Looking at the themes that have been shared, James asks, what does oral history capture or capture better that's missing in mainstream media?
Well, first of all, oral history allows people to tell their story. So it's more about hearing a story in someone's own words versus a journalist or interpreting someone's words. So typically a journalist will quote someone, but often they give context to the story. And oral history provides us with a nice chunk of an individual's experience so that you can pick and choose what you think would be useful for your research or for your own analysis of an experience. So oral history is more of a repository of stories that are made available to the public. Scholars can use these stories, journalists can use these stories, and you also have documentary filmmakers using these kinds of stories. But what makes oral history unique is the kind of interviewing that is conducted. So I would say that follow-up questions are really key. You go into an interview and you quite often don't know what is going to be told to you, what stories are going to be told. So you have to be ready for these follow-up questions. And that is really the beauty of oral history, as well as the fact that it's recorded and made available to the public.
Lilia, do you have anything that you'd like to add to that?
Sure. I think Virginia answered it very well, but one other thing I would say is that the oral histories really let us go in depth in people's personal experiences and their lives. Our very detailed pre-interview surveys that we have them complete give us a lot of background information. And then, the questions that we prepare in advance, and which, can change sometimes depending on what people are sharing with us, they really help us dig much deeper, I think, than journalists are able to do during much shorter sessions. So some of our interviews, in fact, have lasted several hours long because people just, feel the need to talk, to tell you about what they've been through or what their thoughts are, desahogarse, so to speak. And I think that really gives a much more complete and holistic picture than the sound bites that we might see in mainstream media about the Latinx community, for example.
Yeah, absolutely. Thank you both so much. And that is kind of one of the things. I was a journalist for many, many years before I started doing oral histories. And one of my frustrations was that sometimes you would do these wonderful interviews that were very, very long, but then the part of the interview that actually made it into print was very, very small. So you would just use a couple of quotes from it. So it's really great to have the entire interview preserved in some way. Thank you, Gilberto, for showing us that, for holding that up to the screen. We have a question from Mary Sanchez, and I don't know if this is Mary Sanchez from Kansas City, who I've known for many, many years, but she wants to know how many oral histories have been recorded so far by the project. So we have right now 186 interviews that have been recorded. That was as of last week. They're coming in daily. And one thing that does happen is some of us who are instructors, who are teachers, we use them in the classroom. And yes, that is Mary Sanchez from Kansas City. Hi, Mary. We haven't done any in Kansas City, Mary. So we have, if you have people to suggest, please do. So 186, but what happens is during the semester, we have at least 3 professors who are going to use it in their respective classrooms. So we have a professor at UT RGV named Noreen Rivera. She used it for her undergraduates last semester, and they got about 50 interviews that way. So we expect that there's going to be a bump in the interviews, and we'll be continuing to get them, you know, and we have interns, and our interns right now are turning are really working on these for many, many hours a week. Marian Soto says, oral history is not only a way to preserve our history, but it also allows the storyteller to preserve their own narrative. Yeah, absolutely. And people, you know, the interesting thing to me is that the people that we've interviewed for Voces of a Pandemic, and even before that, people are very aware of the importance of what they're doing, and they take it very seriously. And they understand very, very clearly that in order for us Latinos and Latinas to have our story incorporated into our country's historical narrative, we have to do what we have, and we have to push it. And this is something that people are really excited about, and they take their part of it very seriously. And we at the Voces Oral History Center and our partners with Voices of a Pandemic, we take our charge very seriously as well. We keep on doing the very best work, and a lot of the work is incredibly labor intensive and time intensive. And there's just no 2 ways about it. It takes a lot of energy and a lot of work to do what we do. But the trade-off is so rich. And the important thing is that the Latino community deserves the very best. The Latino community deserves excellence. And so we're prepared to do everything we can to make that happen. I've been asked to where we're going to be going from here, and where we're going from here is we're continuing to do interviews for right now. I know some people are getting vaccines, so that's another question to add into the bank of questions that we have for interview subjects. But people are starting to get vaccines. I'm understanding that it's going to take a while before we get to herd immunity, that we're going to be living with masks still for a long time. But that's just for right now. We'll continue to do interviews, but the important thing is that these interviews oftentimes will be even more valuable later on, so that we can do something that's called a longitudinal kind of look at this. So in 5 years, we can go back and we can ask somebody, how did your life change because of the pandemic? And that's going to be very important to us. I got one question from Heather Haynes or Hens. Are you looking for volunteer collaborators to help prepare subtitles and translation? We do have room for volunteers to help us edit raw transcripts. We use an auto transcription program, but that auto transcription program really misses a lot of things. Like, you know, it'll spell my name 8 different ways in 8 different interviews. So we do need people to step up, but we do ask for a commitment from our volunteers, because quite frankly, it's great to have volunteers, but if it also is a lot of work on our end. So we ask for people, if they're willing to be volunteers, that they really understand what they're getting into, because editing a transcript is a lot of work. And so we ask that they edit at least 3 transcripts, because the first time that you do a transcript, it's really super hard. The second time is not as hard, and then the third time is much easier. So we ask for the magic 3. After three of these transcripts, then you're probably going to feel like a pro. So please, if you do have good access to a computer, we'll send you a copy of a raw transcript, and then we'll send you a link to their YouTube interview, and then you can actually edit the transcript. And we would love to have your help if you have the time and you're willing to do it. Mary Sanchez, oh no, Ana Vasquez says, no, I'm sorry here. Mary Sanchez says, are there aspects of the Latino experience in regards to COVID that you believe is not being captured yet by your work? Gaps that need to be covered? I'm gonna ask Lilia and Virginia to weigh in. I can tell you one that I do have one to add. Because most of the people that have been doing the interviews are people in their 20s and 30s. A lot of their network of people that they reach out to are people in their 20s and 30s. We do need more elders. We need more people in their 70s and older. And because I think those are the people that are most vulnerable, but also because I know that it's affected them in a different way. So we would love to have more older people. If you would like to suggest people to be interviewed, or you'd like to step forward and be a volunteer, please email us. Go to vocesofapandemic.org, and you'll see a link there that you can email us. Lilia, Virginia?
Sure. I was just going to add, Maggie, that initially when we reached out to healthcare professionals, I think some medical institutions were very cautious and afraid to have us interview their employees because there was still so much that was unclear. I would hope that that's less so the case now that we've been going through this for more than 10 months. But in terms of other gaps that we need to cover, I think that some of those essential workers have been hard to reach because they're working, for example, people working out in the fields, people working in meatpacking plants, in the construction industry, teachers who are doing remote teaching, that sort of thing. It's been harder to reach those folks. So any ideas, suggestions that folks might have would be greatly appreciated.
Yes, and I'll just add that in my experience, I've been trying to collect interviews with domestic workers, household workers, and that's been very difficult. One, because of technology and lack of access to technology, but another reason is some of these individuals are undocumented, and also they have critiques of their employers. And so they're not willing to go public with some of those very important critiques about the lack of protections they are receiving, the lack of sick pay, the lack of job security, the expectation that they need to live at the home of their employer as a way to avoid bringing COVID or potentially bringing COVID to their employer's home. So there's a lot of issues with household workers that need to be documented. And that's been quite difficult to do.
Yeah, absolutely. And so one thing that I should add is that if in the case of someone who is worried about their documentations, their legal status, we do have interviews that are either just audio interviews, or we give people pseudonyms, or we just look to protect their to protect their identity in different ways. Terry Rodriguez asks, is there a call for artwork to contribute to the funding experience for Voces? I'm a fine art photographer and social awareness artist willing to help. Thank you. There had not been before now, Terry, but I think it's a great experience. It's not my area, but I'd love to talk to you about this. Gilbert Cardenas is the one who's really the art person who guided this effort. So I will talk to Gilbert, and I'd love to talk to you about it. What is our process when choosing who to interview for Marien Soto? Well, it's really largely from our networks. And one thing that we spent a lot of time early in the summer doing was reaching out to different organizations, such as farm worker organizations, because it's really essential that you have the trust of people. People who don't know anything about the Voces Oral History Center or don't know anything about us as individuals, they need to kind of, for them to open up and share, they need to trust us. So the best way that we've been able to do that has been through going through other people's networks and reaching out. And that's one of the beauties of working with Lilia and Virginia and our other partners at the other institutions, is they have their local connections and they have their own networks. So that's been our best way of is reaching out to people. And so what we look for is they have to either be Latino and Latina or someone who's not, but who has an important role in the Latino community. And then they have to have been, basically beyond that, they have to be affected by COVID and be willing to share their story. So it's everybody's been affected by COVID. Rosemary, Hossa wants to know, this is going to have to be our last one. If the Dallas Historical League conducted similar interviews, how could we collaborate with Voces and keep our interviews in our collection and also share them with Voces? Rosemary, that's a great question. You all would own your interviews and you just share them with us, but you own them. We just put them on our YouTube page. So I'm going to share again this one last time the video, not the video, but the artwork, so that you can see again. And I have to say thank you all so much for being here with us today. We really appreciate it. You are now, if you weren't before, those of you who had to sign in to register for this, you're part of our outreach now. So we're going to give you an email in the next few days and let you know more about the Raíces Fuertes y Corazones Fuertes, and also to let you know about any other public programming that we have. So thank you again to our wonderful partners, to Virginia, to Lilia, to Pepe, to Gilberto, and to Pepe for being with us today and being a part of this. And thank you to Keith Berner also for being the person who organized all the logistics behind this. Good night.